To make up for the lack of COVID-19 testing capability, the state turned to the private sector for help. Test Utah accounts for a substantial amount of completed testing, but recent reports indicate the quality of the tests don't match up with what other labs are finding. ABC4's Jason Wynn has the story.
Back on March 23rd, during a Silicon Slopes town hall, Mark Newman with Newman Health shared his plan to bring hydroxychloroquine and COVID-19 tests to Utah.
I think this paired with testing, so access to testing, access to care or to treatment is the trophy for the country.
The way he was going to do it appeared simple on the town hall.
We have partnered with the state and other organizations to be moving this forward. We are breaking down every barrier we experienced, and Chris Cox and Spencer Cox in the governor's office have been incredible at removing barriers as we're trying to figure all this out.
This is the same man who sits on the board of Meds in Motion, a company who recently refunded $800,000 to the state of Utah for an order of hydroxychloroquine.
There's a concern to me that the survey question for Test Utah had a series of questions about hydroxychloroquine on it, which seemed to raise the question of, were they trying to drive business towards hydroxychloroquine, which is 100% unproven.
And an article provided as a statement from Silicon Slopes shows us early on questions arose around the inclusion of hydroxychloroquine in the assessment. This was a decision by the state as part of a prospective standing order for widespread community distribution of a potential treatment. But what about those tests? Diagnostics created the Logic Smart COVID-19 kit to test the disease. It comes with clear instructions. Keep the test on ice, store it in -20 Celsius temperatures, and completed by medical professionals.
I talked to two colleagues yesterday that went to Test Utah site, and they were given the swab themselves and told to take their own sample out of their mouth, so that the patient themselves did the sample collection. That's concerning.
Test Utah's website states that just about anyone in the medical profession can administer the test. In a Friday press conference, Dr. Angela Dunn says only local health departments are monitoring Test Utah testing methods in Provo, Orem, Heber City, South Ogden, Roosevelt, Vernal, and St. George. And if you look at the Test Utah assessment, the state and Test Utah have your data until the COVID-19 pandemic is over.
Sure, and that data is helping public health in terms of identifying risk factors for people who have symptoms and test positive, and so that we can better identify kind of those risk factors associated with COVID-19.
Newman Health CEO Mark Newman tells me Test Utah is providing no-cost tests that are FDA approved and administered by a trained healthcare staff. He continues in a statement, "There are actors in our community that are aiming to discredit this effort. This not only damages Utah companies and healthcare workers working for the good of the state, but more importantly, it disilludes Utahns from assessing the test we all need to be able to return to work and life in the new normal." In Salt Lake City, I'm Jason Wynn, ABC4 News.